Hello, everyone, and welcome to the June meeting of the Global Health Youth Organization. My name is Naraldine, and I'm a co-founder of the organization, and we are very excited to see everyone who joined us today. We want to thank everyone for joining the meeting, and we're here on any scheduling or time zone issues that you might have had. So for the format of today's meeting, we will begin with a quick introduction of our speaker, followed by her presentation, and then a question and answer session. After the Q&A section, we will post the shadowing certificate link in the chat, and we ask that all members stay muted throughout the presentation so that we can limit interruptions and distractions. And please feel free to add any questions or comments that may arise in the Zoom chat. I'll now be passing it over to Adam, the other co-founder of the organization, to introduce today's speaker.
Thanks, Nor. Hello, everyone. As Nor mentioned, I'm a co-founder of the organization. It is so great to see all of you that joined today, and we're happy that we're able to attend this meeting. We want to once again thank Dr. Powley for taking the time to present today. To quickly provide an introduction, Dr. Powley is a professor of public health at Simmons University. Today, Dr. Powley will primarily be speaking about menstrual hygiene management. Please remember to stay muted throughout the duration of the presentation to minimize distractions. Again, if any questions do arise, please type them in the chat and you'll get to answering them at the end of the presentation. With that being said, we will now hand the floor over to Dr. Powley for a presentation. Thank you.
All righty. Good morning, everybody. Maybe that's good morning, good afternoon, good evening to people in all different time zones, which is exciting to have that audience here with us. So thank you so much for having me. I'm so honored and excited to be able to talk to you about menstrual hygiene management. And for some, if that's an unfamiliar term, we'll unpack it exactly what it means. But definitely very, very timely and urgent, I think, discussion, particularly with what's going on in the world and in the US. As it pertains to reproductive rights, as this falls sort of right in line into that. So welcome, and again, thank you for having me here. So our talk today is menstrual hygiene management in US public schools, and that was the focus of my doctoral work, which I did in Massachusetts, if any of you are local around in the Boston area. So that's what we'll jump into today. All right, so I want you all to think about sort of what comes to mind when you think about periods, right? When you think about menstruating. So menstrual hygiene management literally means how do you manage and how do you cope with your period, your menses, your menstruation. There's all different names that we use and associate. But so if you are somebody who menstruates, right, you might think of how it impacts, your cycle. And if you're not somebody who menstruates, right, think about, oh, what is that? That always seems like, a foreign thing that girls go through. So no matter where you are on that spectrum, I just invite you to sort of reflect upon your own experiences, what you know about periods, whether that's personal experience or what you've seen with others, right? And it's certainly a very natural biological experience. Some people refer to it as, one of the most important markers of health, right? Tracking one's cycle, thinking about, everything from pain to duration of the cycle, flow, even all of these can be really important health indicators for the body's menstruate. So welcome, and again, just invite you to be thinking about your associations with the experience of periods. All right, and I do want to say a quick thank you, just share some acknowledgements of those who made the study that I'm going to talk about possible, right? I was interviewing, I'll get into the details, but I was interviewing everybody from students, teachers, counselors, nurses, and if any of you are interested in research, I'm always happy to talk with people more about that, but really important to sort of have an equitable relationship with the people you're researching, and just to say thank you and acknowledge those that gave their time and their voice. All right, so a bit of an overview on menstrual hygiene management, again, coping with periods. On the international stage, right, so if we're thinking about global health, this has actually been something, that people have been thinking about for decades with respect to research, right? Researching how menstruators in schools are coping with their period. Are they missing school? Is it leading to absenteeism? And you're going to hear me use words like menstruator and non-menstruator. And part of that is one, to be more inclusive, right, of varying gender identities. But it also gets at the idea that even if you have, right, the reproductive anatomy to menstruate, maybe you're on the pill, right? Maybe because of malnutrition, some people miss their cycles regularly. So thinking more broadly about menstruators versus non-menstruators is some of the language I like to use. But again, on the international stage, right, it's not a new conversation, even, right, menstruation itself is as old as time, but particularly thinking about the research element of it, it's certainly been going on the global south, right? You can see all different places here across the map. Even Scotland most recently was one of the first nation to pass policy that allows and enforces really there to be free products for everyone, right? And I want you to think about the messages that sends, right? So whether it's a country or even a school says, we want to provide this basic essential item for our students or for our citizens, right? What message does that send? So just take a moment to think about that. And if you want to throw some ideas in the chat, I'm always happy to see some. All right, well, as you're thinking through, hopefully ideas are coming to mind, like, right, people are thinking about your needs. Maybe it even increases a sense of belonging, right? I feel like I belong here if I know that people around me are thinking about, my essential needs as a person, right? Hopefully it sends that message of inclusivity, of prioritizing one's biological needs, right? All very humanizing efforts to say you belong here, your voice is important, your body is important. So sometimes these very sort of what seem like subtle choices can be really important for one's sense of community and belonging, and again, feeling like they're seen, like they're visible. So again, that's been happening on the world stage. And I want to point you to what's been put forth by the United Nations, which is called the Sustainable Development Goals, or the SDGs. These were put forth in 2015 with the goal and hope of being achieved by 2030. You'll see here there's a wide collection of them. There are 17 in total. And if any of you are familiar with SMART goals, hopefully you are, right? It's this idea that they're specific, they're measurable, actionable, relevant, timely. So I encourage you to think, anytime you're setting a goal, think, is this a SMART goal? So meaning, is it just, oh, I want to get better grades, versus I want my GPA to be X and here's how I'm going to move towards that. So making really specific goals is helpful. But on the world stage, right, we see the UN has put these forth as sustainable development goals. They're following something called the Millennial Development Goals. But I want to point us in this direction as we think about these goals. Think about, right, how menstrual equity and how menstrual hygiene management fits in here. So feel free to throw in the chat, right, what are some connections you see? So one more obvious one, right, might be gender equality. Right, predominantly menstruators are people who identify as girls and women, predominantly, not everybody. But right, so if we think about access to education, if people aren't getting the products they need, right, that's combating, that's hindering gender equality, ties right in with quality education. So again, feel free to throw in the chat here any others that you think might be linked to menstrual equity. All right, so a few sort of connections that we've made are things, of course, like reduced inequities. If we go back here, you can see no poverty, right? Overall reduced inequalities, decent work and economic growth, right? If someone has the education that they need, they've been able to, be present for all of that. Sustainable cities and communities, even clean water and sanitation. So you see a number of different ones being tied in here: goal 3, goal 4, goal 5, etc. And the point here that I want you to walk away with is, right, if we're going to stick to those goals that the United Nations set forth, right, we have to be thinking about menstrual equity, right? It's a piece of the puzzle. It contributes to various goals, and it's often, right, something that sort of falls in between the cracks. But the more we get it on the radar, right, the better chance we have of achieving some of those goals. All right, so we've been talking sort of on the global level, but right, US is part of the globe, and I think it's definitely helpful to sort of turn the gaze inwards. And I know in this audience, people are from all over, but I want us to really look at the US, right, and some of our policies, what we're doing here at home, right? I think it's often very common to say, oh, I want to go, help on this side of the world. But I really want to challenge you to say, well, what are we doing at home? How can we sort of clean up house first? right? And knowing that things are very interconnected, right? We're a part of the broader global puzzle. So we gotta take a look inwards first. And I say that for those of you who are located here in the US. So this is a really helpful map just about the current policies with respect to period products in schools and the breakdown by state. And I'll say for any of you who are interested in research or data collection, it's not always the easiest actually to even compile this data. So I want to give a nod to the Alliance for Period Supplies, which put together this graph, because it can be pretty challenging to track down all of the different policies by different states, right? Things are in flux. They're moving through the House, moving through the Senate of respective states. But as you can see here, right, predominantly what we're seeing is a mass of blue, right, which is no requirement of period products being in schools, right? Just the yellow ones here, right, are period products that are required in schools, and then some have funding, right, but not necessarily requirement. So for example, if you're in Massachusetts, we do not yet have a bill on the books that has passed that mandates the provision of products for free for students in school. I will say there are some great bills currently in the State House, the I Am bill, that we're hopeful is going to move on through. Sadly here, right, we're seeing really a mass of blue across the map with respect to that being no requirement for period products in schools. So I just want you to think, right, what would that be like to walk into a bathroom stall? And what if there was no toilet tissue, right? So imagine that like sense of panic, like, uh-oh, I'm in the bathroom, I don't have what I need, right? That's the sentiment that students often can feel, right, if they're without a menstrual product, right? And it's not to be gross or funny, but it's like, that's literally the experience and the panic that people can feel of like, uh-oh, I'm without something that my body essentially needs. So that's sort of the current map and lay of the land with respect to state policy. So not talking federal, not talking the whole nation, but just the state policies. So that's a list there in case anybody wants to refer to it. But I also want to point to sales tax. So my work really focuses on period products in schools in particular, but I think it is important to look at how sales tax is applied to menstrual products. So things like pads, tampons, right? So you can see here, period products taxed at a standard rate. It's across the blue here versus states that just have no sales tax to begin with. And then yellow are the period products that are not taxed, right? So we wish we saw a bit more yellow across this graph or across this map here, right? Because period products are such an essential item, right, that only menstruators have to use. So, right, we can see how that's sort of discriminatory if we're asking just one group of people to not only purchase the products, but then pay tax on them, right? And that amount adds up over the lifetime. So if we think back to the Sustainable Development Goals, right, about economic equality even, right, we're asking one part of the population to pay, right, and to pay something that's even then taxed in addition. So just something to think about, right, as we're thinking about inclusivity, we're thinking about equity, how does this sort of manifest to be creating greater divides between people? And again, here's some of that long list, states that exempt period products from taxation. We wish it were a bit longer, but just something to think about. All right, so I want to dive in a little more deeply on my research in particular. Again, this was part of my doctoral work. I don't think I shared with you guys that I actually began my career as a New York City public high school teacher. So that's part of what spurred my interest in this field. I was also somebody that always struggled with really bad periods, really bad cramps. I remember having to leave class and then your teacher sort of giving you the side eye, like you left, how come you didn't come back? Right, so all these things can sort of interfere with you receiving and achieving the best education possible. So a bit more about the research itself, but again, that's what sort of spurred some of my interest and love for this subject. So some of the driving questions. So again, if you're ever interested in doing research, one of the first things you do is just design some research questions. What do you want to know, right? You don't want to just jump into the data haphazardly. You want to be really intentional and say, what am I actually seeking to know here? So firstly, I was really curious just how are students coping with their period at school? So what I had seen as a teacher and what I had experienced myself firsthand, I was like, there's something going on here that we're not talking about or not talking about enough. So my primary research question was just how do students describe the ways that they manage menstruation while at school? And then the follow-up to that was not only the management itself, but what's the impact, right? So how do students describe the impact of menstrual hygiene management upon their physical and mental health and their participation in school-related activities, right? So when we say health, right, we want to be thinking, right, mind, body, et cetera, though, right? Thinking about people in their entirety. So impacting their physical and mental health, but then also their ability, right, to attend and be a full student. Can they go to extracurricular activities? Can they partake, right, fully in every class? Or are they in pain? Are they in need of a product? So again, something to think about. The other two, I won't delve as much into, but it's what are students' perceptions regarding the school's role in mitigating any challenges related to menstruation management. And that basically means, like, do students feel like the school should provide them? Are they happy providing them on their own? What's the sense of almost entitlement? I know that can kind of be a dirty word, but entitlement of like, yes, I deserve this. This is important. So not entitled in a spoiled way, but entitled in like, yes, this is something that we deserve, the same way we deserve toilet tissue to be in the stall and hand soap, right? Just basic items. And lastly, how do school staff members, teachers, nurses, counselors, janitors describe students' experiences, and how do they perceive their role in shaping these experiences? So for anybody who's interested in the medical field, even education field, I want us to be thinking broadly in terms of population impact. So if you're interested in impacting students, you got to think about, right, the people that are constantly in interaction with them daily. So the teachers, the nurses, right? If similarly, I'm thinking school nurses there, right? And counselors. Similarly, if you're interested in patient well-being, right, you think about the doctors that are constantly interacting with them. Think about the nurses that are interacting with them, right? So how we can often help a targeted population is by thinking about those outside of, but in interaction with that population. So just to kind of keep that in mind there, that was certainly what was driving that desire to speak to other stakeholders as well. All right, and some of the methods. So basically, how was I going to achieve these research questions, right? What was I going to do to try and answer my questions? Well, there's something called mixed methods research. And what that essentially means is that you're using a number of different approaches and methodologies to get at your research questions. So in this case, I used both qualitative and quantitative data. So just as a reminder, qualitative data, right, those are words, they're descriptive, right? Conversation with somebody in an interview, right? You might be taking notes, jotting down their comments. So that generates qualitative data. Similarly, focus groups, right? You meet with a group of people, you're noting what they say. That gets us at some qualitative data. On the other side here, you'll see I included quantitative data. And most of you at this point, I'm sure, have taken a survey at some point. And particularly close-ended survey questions, that's what helps us to generate quantitative data. So even if you think about like a yes or no question, right, you can get 1 little point for yes, a 0 for no. And then by the end of that questionnaire, by the end of that survey, right, you can tally up somebody's quote unquote score. And that's what generates numerical or quantitative data. So just a little refresher there on the different types of data collection. These are the particular kinds that I use. So both qualitative and quantitative. I included interviews, focus groups, and the youth risk behavior survey. For many of you I know are high schoolers. If you've ever taken that really long survey, asks about, you know, everything from bullying to sexual behavior, drug use behavior. That's probably that survey. And what I was able to do is add a few questions about menstruation to that particular survey, which unfortunately are not commonly on those types of surveys. So that's certainly an area for future research I'm interested in, or future advocacy even, is getting more of menstruation related questions on important surveys, so we can even get a sense of what is going on and sort of on a higher level. So with that said, those are the methods. Who was interviewed? So this brings us back to this idea that, right, if your concern or your focus is the student, it's often wise to, yes, of course, talk to them, right? They're your focus, they're your center, but think almost in concentric circles of like who's sort of right, the immediate bubble outside of them, beyond that. So in total, there were 11 high school students. 8 of them were menstruators, 3 were non-menstruators. I found it really important to speak to people who don't menstruate as well, to get their perception on, right, everything from stigma to, right, experiences in general, because we all create culture, right? If you think about stigma and taboos, all that, that's created by everybody in a community, right? So we want to know what are the experiences of people that are directly, right, getting their period, but also those who don't, right, can be part of the conversation. So also some teachers, right, across subjects, math teachers, English teachers, science teachers, again, a mix of people who menstruate and those who don't. And then other school staff. I don't know if any of you are familiar with school adjustment counselors. Sometimes they're just broader academic counselors, but those in my study were school adjustment counselors, school nurses, head of janitorial services. And the thinking there was, right, if a school passes a policy to offer products to students, whose shoulders might that fall on? So for example, if it becomes something that's just available in the bathrooms, are we going to end up asking janitorial services, right, to add that to their laundry list of things to do? Are they going to be, restocking items? So kind of getting their voice in there to say, is this feasible to add to your list, right? We want to think again, very sort of comprehensively about the population that's impacted. Right, so that was the population. Again, the survey data was just students. So interviews, focus groups, interviews was across the spectrum here. The focus groups were just for students. And the survey itself, the youth risk behavior survey, was just for students. All right, and in addition to that, so in addition to the mixed methods, the quantitative data, the qualitative data, I added something called satellite cases, where I was able to do a few more interviews with everybody from state representatives to student advocates. I really highly encourage you all. I hope you know how important your voice is when it comes to advocacy. From having met with state reps, worked with state reps, they love to hear your voice. I think there's something really inspiring about having you all stand up and say, this is something we need. So I strongly encourage you to remember that public servants, right, politicians, they're people that work for you. So again, coming back to that idea of entitlement, right? Don't be afraid to raise your hand, raise your voice and say, wait, we're not being offered this. Why not? So again, that was part of the motivation for delving into some of these other satellite cases. Boston Public School ended up having a pilot program where they had some money allocated that they wanted to figure out how best to get products into students' hands. So overall, this was sort of some other advocacy efforts around menstrual hygiene management. All right, so let's talk about the findings. I don't want to bore you all too much with the methods, but the findings, right? What were people saying? What came out of this data? So ultimately, there were 5 big themes. One was about access, another about clarity, right? Communication, do we know what's available, right? Whether or not it is available, but what do we know, right? What is clear to people? Versus adults, and I'll talk about that one in a second, attendance, and then inequity. So if we look at the access one, right, we can see over 27% of students either disagree or strongly disagree with the statement, I can get free pads, tampons, or sanitary items while at school that are provided by the school, right? So over a quarter of students saying, no, I don't think I can, right? Which is pretty disturbing given the fact that this particular school, which I'll have remain anonymous, but the particular school, their policy, at least in my discussions with superintendent, with the nurses, is that they do offer products, right? So, but you still have students saying, right, over a quarter of students saying that they can't get free products there. So I think that brings us to the next one about clarity, right? So nearly 1/3 of students said they don't know regarding the statement, right? So even if you offer products, if people don't know that, if there's a sense of confusion, right, even about how they might obtain them, that's an issue, because it's one thing to say, okay, we'll make it available, but if people don't know you're making it available, right, then they're not utilizing that resource. So we think a lot of, in this policy work, a lot of it is thinking about implementation. Even if the bill passes, how do you make sure, right, what's intended actually happens, products reach people? All right, and then adults. So I want you all to take a moment and just think about an adult at the school. If you're particularly for the high school students, think about an adult at the school who you might feel comfortable asking for something you need. Maybe it doesn't even have to be a period product, but do you have at least sort of one adult at the school that, something's happening, you're like, yeah, I can go to this person, I can talk to them. So just take a moment to think about that. It doesn't even have to be a teacher, it could be a counselor, but just one adult at your school that you feel you can reach out to in a time of need. All right, well, my wish for you all is that you're all thinking, yes, I can identify somebody, But in this particular study, so almost half of students disagree or strongly disagree or do not know if there is an adult from whom they would feel comfortable asking for a sanitary item if they needed one. So that's almost half of students, right? So imagine you're in need of something while you're at school during the day, and half of students saying, no, I can't think of anybody from whom I'd feel comfortable asking for a sanitary item. So just, right, we think of the power of that, right? You're in need of a pad or a tampon, right? But can't think of an adult or don't feel comfortable, right? Identifying an adult that you feel comfortable asking for something. All right. And again, part of that might be, right, there's stigma, there's taboo around sanitary items. But I think that certainly sends a message about having, right, comfortable relationships with the people that are there to support you as students. Alrighty, and then attendance. So over 25% of menstruating students do not attend school for at least one day when they have their period, right? And this is huge. So if it's at least one day per cycle, cycles are approximately 28 to 30 days, right? And there's a tremendous range across menstruators, but on average, right, that's roughly once a month. So if you're missing at least one day per cycle throughout the school year, that's one day per month, 10-month school year, you're looking about 10 days missed from school, which you can equate that to about 2 weeks, right? So imagine an entire population, right, of people, of menstruators, 25% of them saying, I missed 2 weeks worth of school, right? That's 2 weeks of math, 2 weeks of English, right? That's a fair amount of content that you're missing out, right? I know you all have state tests, things that you're, exams, things you're tested on. Imagine missing 2 weeks worth of content, right? So that really adds up. And then inequity, right? Thinking over 1/4 of low-income students reported that they either strongly disagree or disagree with the statement, I can get free pads, tampons, or sanitary items while at school that are provided by the school, right? So we want to think about access really broadly here. So access in particular, right, can be affordability. And then also just, can I access it? Is it somewhere, even if I had the money, right, that we can get? But I want us to think about affordability. If we have low-income students saying they're not able to get the products, right, that's definitely an issue of equity that we want to pay attention to. So those are, again, some of the 5 big themes of results that came from the study. Here's again, just sort of breaking down the overall responses. So again, the statement on the survey was, I can get free pads, tampons, or sanitary items while at school that are provided by the school. You have, right, 12% saying strongly disagree with that, 15% disagree. And then the really disturbing, I think, is 30%, over 30% saying, I just don't know, right? Because even then that falls into the no category. If you don't know, then you're likely not seeking them out if you think they're not there. All right, and so some next steps and recommendations. If you are at a school that does not currently provide products, whether it's in the bathroom, in the nurse's office, I really encourage you to lift your voice up and say, why aren't these things here, right? I want you to, again, be thinking, we deserve these, right? It's a natural experience, right? A natural bodily function. So getting pads and tampons or whatever product you choose to use, having that available, really important if you're at a school that doesn't have them. But with respect to the particular school where I did my study, a few of the recommendations that I wanted to come back and share with them is, right, just informing. So making sure that everybody's clear on the policy. If they do, in fact, offer products, right, making sure people know that, right? Some of the teachers were saying, oh, I'm not even sure if I can send a student to the nurse to get products. We're just not sure, right? And that lack of clarity, right, brings us to the next one here, right, about making sure people are really clear about what's available, how they can access it, right? Do they need to wait in line at the nurse's office, or can they just run into the bathroom and grab one? All of that stuff matters, right? The logistics matter of how one might, right, roll out a policy or a program to make these available. So definitely inform, clarify, and then even just supply, right? I know that's a pretty straightforward one. But thinking about how and where you might supply them. Is it in the bathrooms? Is it giving them to teachers? I think all of that, right, we think about the dynamics of the school, letting them decide, but making sure that products are available is something that students definitely shared, is a need. All right, so I will pause there. I thank you for your ears, your attention, but I want to pause to welcome some questions if there are any.
Thank you so much for the amazing presentation. So if it's all right with you, we will now begin the Q&A section. So we're first going to go through the questions that were asked in the registration form, and then we'll get to any questions asked in the Zoom chat. So this is your opportunity to ask questions. So please, everyone, ask whatever you have in your mind. So the first question we received through the registration form was, how can we maintain menstrual hygiene management in developing countries?
It's a great question, and I want to even highlight the fact that it was typically developing countries that really spearheaded this field. And I even when I teach, I encourage students to deconstruct even the language we use around developing or less developed, more developed. Right, to think about that very socio-historically, right? If we're calling a country less developed, why is that? What does that imply? Sometimes we say middle income or low income countries. But there's certainly, right, geopolitically, a lot of stuff that's happened that's led countries and nations to the different positions that they're in. But returning to the question itself, so maintaining menstrual hygiene management in developing countries, I think just the attention that's growing, I'd love to see that momentum continue. I think I didn't get too much of this into the presentation, but paying attention to, right, stigma, taboo, right, the shame that sometimes menstruators feel, like if they leak and all of that, right, there's almost a sense of embarrassment when there shouldn't be, right? So how do we move towards both in the US and internationally removing some of that stigma?
Thank you so much for that insightful answer. Our next question was, what led you into this field of study?
So I think I shared a bit of this earlier, but I think my own experiences as a menstruator, right? So from everything from cramps to fainting, vomiting, just really bad menstrual symptoms. But I think it was also, I remember feeling tremendous shame about like having to miss class, and oh, is the teacher going to think I'm cutting class? Right, there's sort of that disconnect where it's like I'm in pain and I need a product, I can't find one. Right, and not wanting that to be visible, but at the same time wanting to tell the teacher, like, I'm not cutting your class, I'm like struggling here. But yeah, I think that led me towards the field. And then I'd say also being a high school teacher and having students ask me frequently for products, really, I think kind of became a common sense reaction of, this should be available for you guys. So that at least on the personal side is what led me there. And with respect to the research, I love doing work that centers students' voices, that lifts up, right, their needs. Again, getting back to that sense of belonging, right? How do we encourage students to really use their voice when they're feeling like, you're sending messages that I don't belong here, or you are sending messages that I belong here. So ultimately, I'd say my own experiences, and that it's a really focal point about belonging and equity.
Thank you so much for that insight into your background. So next question is a little bit broader. It's what fascinates you about health or medicine in general?
It's a great question. I think it is so interdisciplinary in my mind, the field of health, right? It's broad, both in a good way and maybe a challenging way as people are trying to sort out what career path they might want. But I like to think about health really holistically, right? It's mind and body, and not thinking of the two separately, but in the interconnections. So that's definitely something that's drawn me to the field, right? So I work on menstrual hygiene management, but I also think about the ways that it impacts students mentally, right? So it's almost, hopefully it doesn't seem like too much of a leap, but from menstrual hygiene management to belonging, all of that's health. So that's certainly what pulls me in that direction.
And another question that's also a bit not really on the presentation topic, but more general, is what were some of your favorite experiences throughout your career?
I would say there were things I really loved about teaching high school. I know many of you are high school students. Be nice to your teachers. It's a tough job. But so many of them really are truly called there because they care about you. They care about your well-being. May not always feel like it, but I promise those educators are there, and they truly do care. And I was really blessed to work with many of them. So I'd say that was a highlight. I really enjoyed also my master's in public health. So thinking about health at the population level, looking at trends across groups. My background in college was a gender studies major, which I always sort of think about as a part of sociology. So really interested in combining sociological concepts across health, right? And all that, I think, again, ties back to equity and belonging of whose bodies do we consider? How do we treat them? How do we not treat them? So I'd say definite favorite experiences were teaching, and I really enjoyed my master's in public health work. And it's what led me to this field that I'm in now.
Thank you so much for that response. So the last question that we received through the registration form was, what advice would you give to someone interested in entering a similar field of study?
I would say a few things. One, it's okay if it's interdisciplinary. I think there's a tremendous emphasis on being really specific with your focus, and I think it's okay to have multiple interests, right? And realize that what may even seem niche is very interdisciplinary. So I would definitely advise that, to be open to the interdisciplinary nature of your work, right? To realize that if you are going to practice medicine, right, be thinking about sociology, different genders, different racial groups, right? We don't want our worlds to sort of operate in silos. We want to be thinking broadly about how we can support people. Again, sort of mind and body as well.
Okay, so that's all we have for the registration form. And to go to the Zoom chat question, so we have a question from Phil Zager asking, what do you think are some of the largest disparities that we see across the world with regards to menstrual management?
I think access to products is a big one, but it certainly doesn't end there. It's also access to education. The fact that menstruators are bleeding for the first time and going, oh my God, am I dying? Like, didn't expect this. What's my body doing? I think even that shock is really not fair to young people, right? So providing them that education is a major current disparity. I would say also thinking about low income populations. As I mentioned before, access, right? It's about, yes, can I even go somewhere to obtain the products if I had the money? But for those that don't, I've worked on some papers with thinking about homeless menstruators, right? And we think of already many of the dehumanizing experiences that they already go through, and to add this on top of it, both homeless menstruators and menstruators more broadly, right? Having to use things like, balled up toilet paper. People even said, parts of diapers, socks, towels, right? All of these things that are not only not healthy, but that I think can have an impact, again, on sort of the broader mind and body of how you feel and how you're able to get through your day. So I definitely want us to be thinking more about those disparities in terms of, again, racial and ethnic groups, low income populations, and those who are housing insecure.
Thank you so much for that response. So the last question we received in the Zoom chat, if there aren't any more, is, in developing countries, the counter argument is that free provision of menstrual hygiene products can lead to wastage and exploitation. How do you see this? Yeah,
that's a great question, Fatima, and I'm glad you're thinking about, we sort of think about the broader idea of unintended consequences, right? So a policy passes and we go, hooray, we're now going to have, products available for everybody. But I'm glad you're thinking this way, because we have to think about, well, what's happening with those products, or even what types of companies are getting the contracts to provide that. So definitely there's concern about, right, the increased volume of pads and tampons, which are not commonly biodegradable. I think there's been more of a move to organic products, and but it's certainly a challenge. I know, again, different products coming on the market, like the Diva Cup, ones that are reusable. I think there's, I would say, some barriers to entry around different products for various reasons, whether it's cultural or even people's own comfort with their body. But I'm glad that's on your radar, because it's definitely a concern about how do we engage sustainably, right? And that was one of the Sustainable Development Goals. How do we live sustainably with our planet when these products, right, may end up in landfills, which is really scary. So I'm gonna pose that challenge to you to think about how we can come up with more products that are maybe biodegradable or more sustainable for our planet.
Okay, so I think that's all the questions we had, and thank you everyone for putting in those questions, and thank you, Dr. Powley, for all those amazing answers. So we once again like to thank Dr. Powley for taking her time today to give us an introduction to her work, and thank you all for attending today's presentation. please use the link posted in chat to obtain your shadowing certificate. And thank you all so much for attending, and we look forward to seeing you at our next meeting. And we're going to stick around for a couple of minutes to make sure everyone has access to the link.
Thank you so much, Dr. Powley.